According to Doctors Without Borders, Mozambique has one of the highest HIV prevalence rates in the world. The NGO says 13% of the population aged between 15 and 49 are infected, while more than 34,000 people co-infected with HIV and TB die each year. Dr. Cruz says following the changing of the HIV drug regime in 2019, with the intention of helping HIV patients, they realized that in fact the opposite was the case in some instances.
So we realized that there was a problem with the medication when we started seeing patients that were not improving with the current medications, because they were with very low CD4s and very high viral loads, as well as clinical deteriorating. They were with many opportunistic infections, and we knew that these patients have good adherence support from psychologists and counselors, and even with this clinical support and psychosocial support with good adherence, they continue deteriorating. So we saw this that could be important to test these patients with this genotyping test, just to make sure that these medications were really ineffective or were effective, and to see if they were ineffective, if they would have another options.
Dr. Cruz says by genotyping, a procedure used to test the efficacy of drugs in patients, they were able to make the necessary interventions.
So this test we use is a test that can detect some mutations that can occur in genome of or gene of HIV cells, and this test can monitor the treatment. If a patient has a resistance to determined medication or specific medication and is doing this medication, it won't be effective. So there is a need to change or switch the regimen to another one that is effective. So genotyping test is a test that can be done just to show the inefficacy of the current treatment and another options that could be used that are very limited in our context.
She says with better communication between governments and health officials on the ground, such situations could be avoided and more lives could be saved.
I think communication is done, but it's not. We have some issues yet to face, because we have to arrange some art committees to decide for these regimens, and I think we have to improve this communication. I think it's not enough. It's really more centralized, and if there will be an improved communication between the central part of Mozambique or in the Maputo, that it's capital of Mozambique, if they have the more accurate data, if they have better communication and have all the tools in the other provinces, I think it would be more important and more accurate. Right now, I think we have lack of this link between the government and that is very centralized.
But all is not lost. Dr. Cruz believes there are efforts in dealing with advanced HIV infections in Mozambique are bearing fruit.
From people that arrive in hospital, I can see that I think there was a decrease in the numbers of patients that are going there. Not because the incidence has decreased, but patients that are severe to go to the hospital or have advanced HIV disease has decreased a little bit. I believe that it's thanks to the health centers that, by the mentoring that MSF did, that they are more aware to detect patients with HIV that need prompt treatment, and even the services, they are more, they have CD4s, another test to screen another opportunistic infections, and if they screen it early, patients are not severe enough to wait and go to the hospital to make this treatment. So I think that it decreased a little bit, and it was a little bit increased in the management of this patient. But we have to fight. It's not perfect yet.
As they say, done is better than perfect. Sipho Kekana, SABC News, Beira, Mozambique.